You're welcome to my channel. Thanks for visiting. Remembering to subscribe, sharing all my presentations, and listening to this very one. Today is about that popular dangerous gas known as carbon monoxide. YouTube and myself are concerned about stuff that are claiming lives that are not supposed to be. So, the main reason for presenting this is to let us know how we can run away, avoid, or escape death from carbon monoxide. With that in mind, you can see this burning right. Is it only when we could see flames like this that carbon monoxide could be present, or can it be present even when we don't know? Can it be around us and we will not even be aware of that? All these will be addressed here. And is it treatable? Is it preventable? All these will be addressed right here. So, without much ado, let's go. The first thing to note is asking ourselves some questions about carbon monoxide. Can it be endogenously produced? Do you have the answer? Meaning, can our body generate carbon monoxide without inhaling it from something burning somewhere outside? Do you have any answer? You'll know in a bit. Can it be physiologically eliminated, and at what level? We'll know in a bit. The concentration of carbon monoxide in the system determines its severity. Needless to say, right? But at what concentration? We'll know. Can it be found everywhere? Meaning, even when you've closed the door in your house or you open the door in your house, everywhere can it be found? Good lungs and oxygen will be helpful. Is that true? Is it worse in enclosure? We'll know in a bit. Is it a preventable and treatable condition? We'll know later on. How is it diagnosed? Is it mostly by eye index or suspicion? We'll know. Why is time of essence here? All these things will be addressed very soon. So, let's go. Carbon monoxide is a gas. It is a colorless, odorless, tasteless, and non-irritating gas. That is serious. So, when you could see it, you run away, right? When you see smoke, you know there's smoke and you run away. When you sense if your olfactory organ is still working perfectly, you run away, right? When you feel the taste, you run away. When you are irritated, you run away. But unfortunately, you're not going to get any of this when it comes to carbon monoxide. So, it is fair to say that it is a silent killer. It could kill quietly because you cannot see color, no odor, no taste, and is non-irritating. It is a carbon atom and an oxygen atom. It is linked by a triple bond. You can see this is carbon atom, this is oxygen atom, and this is the triple bond. Other names could be this, and I've taken time to bring this up because you might be reviewing this through some literature, and then you find carbon monoxide being referred to differently. Could be carbon monoxide like I'm using it right now. Could be called carbonous oxide. Could be carbon 2 oxide, Carbonyl, fuel gas, or monoxide. As a biological regulator, carbon monoxide is one. It can naturally modulate inflammatory responses in the body, acting as an anti-inflammatory agent and as a vasodilator agent, just like nitric oxide or hydrogen sulfide. It is a dangerous gas. Please, we should not joke about it. Like I said in my introduction, YouTube and myself will not bring out any presentation that will add more injury to human beings. Rather, we're working to see that everybody will run away from what we're supposed to run away from and live our life in peace, in harmony. Carbon monoxide is one that we have to run away from. It is a dangerous gas, please. Carbon monoxide poison. It is the buildup of the gas in the bloodstream that is of a great concern. Okay? It is formed when there is inadequate oxygen to produce carbon dioxide or carbon 4 oxide. Meaning, if there is enough oxygen, CO2 will be produced, not CO. Any burning fire will release some amount of carbon monoxide, but the amount may not be dangerous if there is adequate ventilation, like when you have your chimney or windows open, the doors of your garages and homes are open. Even if there's burning, it may not be up to the level that will be dangerous for human beings. Okay, let me quickly mention cyanide here. That the commonest source of cyanide is smoke inhalation. And someone will ask, what's the problem delving into cyanide right now? Well, of course, we are going to get cyanide from smoke inhalation just as we are going to get carbon monoxide. And that is pretty dangerous because they will have synergistic effect. Now, inactivating cytochrome oxidase, thereby leading to destruction of aerobic cellular respiration. The aerobic cellular respiration is responsible for the production of ATP. Now that aerobic cellular respiration has been disrupted, then we are left with anaerobic respiration, and that is the available source of energy to cells. And when we're battling with anaerobic respiration, there will be more lactic acidosis and cellular death. Now, epidemiologically, carbon monoxide could be from intentional poisoning with carbon monoxide. Please approach your doctor, approach your family members for anything that is bothering your mind. Don't do it. It's going to take your life. But most of the times, people with carbon monoxide poison, they will get that inadvertently, meaning they didn't plan for it, they didn't even know it exists because it is colorless, it is odorless, it is tasteless, and non-irritating. So people will just be there inhaling and inhaling it, and they won't even know. And nobody is blaming anyone right now. That is why this is important that we listen to this. It is more in winter months. Now, let me address this. Winter months in countries where that is the case, there are some parts of the world that they don't even have winter, and no, they won't know that. But that doesn't mean they don't have carbon monoxide. They do. Okay. The reason why it is more in winter months is people are more indoors with fireplaces and furnaces working. Mortality is higher with intentional poisoning. Do you know why? The individual has made up his or her mind to do that, so he or she won't even get out, to breathe in the air. And that is not good for you. Remember, you are loved. You are cared for. Someone loves you somewhere. So seek help, please. Neurocognitive impairment will likely follow carbon monoxide poisoning later on. Okay, here is a big question, but the answer is not so big. And the question is, from where? Doc, how can I get carbon monoxide? From where? Okay, let's go. Sources of carbon monoxide. First thing that I'm going to address here is endogenous production. Meaning in your own body, you can naturally produce carbon monoxide by the oxidative catabolism of Hem component of the hemoglobin, catalyzed by M oxygenase 1 and 2 on the M component of the hemoglobin when it is broken down. Hence, a low level of carboxyhemoglobin, that is as low as 0.5 to 1%, but some literature will just put it less than 10%. So I'm putting everything here in case you are reviewing your facts from such literature that it is less than 10%. That's fine, but very low as 0.5 to 1% will be generated in every normal person, even without atmospheric inhalation of carbon monoxide. How about that? The reason why we don't have problem with this is the level is pretty low, okay? So cannot give us any clinical signs and symptoms. When endogenously produced, then the next question is, where will the carbon monoxide go? Well, there's a good news here. It is going to be excreted when you breathe out. Remember, the level here is pretty low, okay? Some literature put it at less than 10%, like I said earlier. It is less occurring naturally. That doesn't mean it cannot occur, but it is less, when it comes to natural occurrence in the atmosphere. That can be from volcanoes, forest fires, coal mine gases, or lightning. So in natural disaster conditions, there may be carbon monoxide somewhere. It is higher in enclosed areas and cities, more in vehicles with emissions, and burning items. Okay, still on sources of carbon monoxide, underground electrical cable fires and water pipes fires can produce carbon monoxide. Methylene chloride, that is meant for paint removal, can be metabolized in the liver to carbon monoxide when methylene is inhaled. When carbon monoxide is in the blood, then we'll give it another name, carboxyhemoglobinemia. Still on sources, it's going to be from the partial oxidation of the carbon-containing compounds. The half of all carbon monoxide in the atmosphere is from burning of fossil fuels, burning of forests, bushfires, and house burning. Also from vehicle exhaust emissions, but it is only when it is occurring in poorly ventilated garage. So it doesn't mean people driving along the street, then you are in trouble. No. The carbon monoxide will be there, but in low quantity, please. It's only when it is in a garage that is poorly ventilated that it becomes a problem. Other sources of carbon monoxide will be cigarette smoking. Remember, I've said that earlier, that even with cyanide, okay? Camping stoves, charcoal grills, poorly fixed or malfunctioning heating system, any stove in an enclosure could give you carbon monoxide. Others include kerosene heaters, warehouses, enclosed internal combustion engine, generators using petrol or kerosene, coal gas for cooking, heating, lighting, or transportation. Others will include ice rings, hurricanes, iron smelting, volcanoes, or lightning. Ocean, geological activities with natural gases coming from coal mining. The effects of carbon monoxide. It has higher affinity, meaning carbon monoxide has higher affinity than oxygen when it comes to binding to hemoglobin. The carboxyhemoglobin formed would then result in decreased oxygen transport and subsequent oxygen release into the tissues. That can lead to inflammatory cascade that will lead to central nervous system lipid peroxidation and a delayed neurological sequelae. The pathway is essentially that carbon monoxide will be inhaled. When it is inhaled, it will pass through the pulmonary capillary bed and the membrane, and that will afford it the opportunity to bind to the M component of the hemoglobin. Here, has a ring like porphyrin, which an ion atom will attach to. The ion atom will reversibly bind oxygen as the both travel from the lungs to the tissue. Carbon monoxide will then bind to that ion at stronger affinity. The level is as high as 200 times higher than the rate at which oxygen will bind to it. The rate and level of carboxymoglobinemia is a function of certain factors, meaning how much of the carbon monoxide will remain in the blood and be transported by the blood will be a factor of how long the individual has been exposed to carbon monoxide, duration of exposure, the degree of perfusion, the concentration of oxygen in the system and around, meaning there are two competitors, the oxygen and the carbon monoxide. But remember, carbon monoxide has stronger affinity to bind to the hemoglobin. So the ratio of oxygen to carbon monoxide present would determine how much of the hemoglobin will be occupied by carbon monoxide. If oxygen is higher, then less carboxymoglobinemia will be the problem. Then there is no signs and symptoms. But if oxygen is low and carbon monoxide is higher, of course, needless to say, there will be more carboxymoglobinemia, then there will be trouble. The degree of lungs functionality will also determine how horrible the situation will be. So someone with chronic obstructive pulmonary disease already struggling to breathe normally with O2 side that is low already, now exposed to carbon monoxide, needless to say, he or she will suffer more. Then underlying ischemia or hypoxic situations will also determine how much of the carboxymoglobinemia will be a problem. Like we are talking about low level of perfusion in any shape or form. And on top of that is carbon monoxide in the blood of that same person, then there will be more trouble. Now, carbon monoxide and cyanide will have synergistic effect. They can inactivate cytochrome oxidase, thereby leading to destruction of aerobic cellular respiration, and that is responsible for the production of ATP. Okay, the anaerobic respiration is the available source of energy to cells, and with that, there will be more lactic acidosis and cellular death. Now, carbon monoxide half-life. I want us to be very serious about this. When we reach treatment, we might need it again, but let's take the knowledge right now that if there's hyperbaric oxygen, then carbon monoxide half-life will be dropped to 30 minutes. But in high-flow oxygen non-rebreather face mask is 90 minutes. If it is in room air, meaning no oxygen is supplied by any physician, nurse, or doctor, or therapist anywhere, the half-life of carbon monoxide will be 300 minutes. Now, what are the signs and the symptoms of carbon monoxide poisoning? Like I said earlier, it is odorless, colorless, tasteless, non-irritating gas. How then can you know you're in trouble that you've inhaled carbon monoxide? The clinical features are not specific. So, an individual will likely come down with headache, nausea, vomiting, confusion. That will be the commonest way it's going to present. It's either the poisoning is mild or severe, and that will determine the level of severity. Hypoxic state here will affect the brain and the heart. Now, I'm not saying those are the two organs that will be affected, but they will pay more price. That is, the brain and the heart will be affected more than the rest organs in the body. Now, when it is mild, okay, there will be cherry red leaves and skin, maybe headache, nausea, vomiting, and dizziness. That is mild, could be easily handled. Still, when it is mild, mild means the concentration of carbon monoxide is not extremely scary, but it's not good anyway. So there will be reduced level of consciousness, flu-like symptoms, confusion, fatigue, and vertigo. Now, here's the trouble. When the level is pretty high, that means severe poisoning, then there will be loss of consciousness, chest pain, heart attack, seizures, ataxia, the lung will become congested, and of course, breathing difficulty. Still under severe cases, there will be lactic acidosis, ventricular arrhythmia, syncope, delirium, coma, and of course, what we don't always want to hear is death. Delayed neurological sequelae will follow later on. Within 3 to 365 days, meaning within 3 days to 1 good year, then delayed neurological sequelae can follow. That will include cognitive deficit. Let me explain further. Delayed neurological sequelae doesn't mean the individual has inhaled very toxic level of carbon monoxide and then you leave the person there unattended to. No, not only that. When the individual has even received treatment, there's likelihood of delayed neurological sequelae, and it's going to appear within 3 days to 1 good year. So, and that will include cognitive deficit, personality changes. This is horrible, right? Movement disorders and focal neurological deficits. Now, delayed neurological sequelae. It is a recurring transient neuropsychiatric consequences of carbon monoxide intoxication or a delayed encephalopathy. There may be some of the following in anyone with DNS: mild headache or severe headache, maybe seizures, peripheral neuropathy, or even urinary incontinence. Still on DNS, maybe dementia, labile emotions, personality changes, psychosis, and cognitive disturbances. Still on DNS, there will be altered level of consciousness, amnesia, vegetative state, movement disorders, and lethargy. Now, another big question is, how can we know? Meaning, how can we make diagnosis of carbon monoxide poisoning? Remember I said through the presentation on the clinical features or symptoms and signs that it is non-specific. Then, how are we going to be know for sure that it is carbon monoxide poisoning? Let's go. The diagnosis here will be majorly centered around high index of suspicion. Wow. Somebody is saying, is that it? Is that all? That is not all, but that is the beginning of it. Let me tell you a brief history here. There was a case in a particular community in the Western world, advanced country, where a group of people were presenting in the hospital with similar signs and symptoms that were not specific. So the doctor was like, you guys are living in the same place. So the address was reading the same apartment building. And the doctor said, okay, I can take a guess. There's carbon monoxide poisoning there. So they called 911, then they evacuated people in that building. The doctor was given recognition for that high index of suspicion. That is the key here to diagnosis of carbon monoxide poisoning. high index of suspicion. By the time we're done with this, you understand why high index of suspicion is the key. Okay, there will be variable or non-specific symptoms. Also, you are now finding out that 1, 2, 3 or more people belonging to the same household are the ones down. Or is a group of people living together in the same place, or no, they just have something in common at the same time and they're presenting with similar signs and symptoms. Neighbors in an apartment building or a house are firing up or killing up at the same time. People working in the same establishment, maybe one big office or warehouse, 1, 2 people are complaining about the same thing, the same time. They have something in common. Living together in a house, they belong to the same group, they are neighbors in an apartment or building or a house, they belong to the same establishment, and the signs and symptoms that they are presenting with are similar and occurring around the same time or the same day. Then your index of suspicion should set that I might be dealing with carbon monoxide. Still on diagnosis, we take thorough history. Now, the people who are together, living in the same house, this is winter time or not, garage door 40 not open or opened, fireplace turned on, furnace turned on, not serviced for a while, smoke is seen or not seen because it is colorless, odorless, tasteless, non-irritating. So they don't have to tell us whether they sense it or they don't sense it. They may not even know whether carbon monoxide detector is in the house or not. All these things will be asked, and of course, we do thorough physical examination. Now, immediately, we will go for 8-wavelength pulse oximeter. That should be in progress, and it should be in progress pretty quickly. That will help us to know about hemoglobin oxygen saturation, methemoglobin, and carboxyhemoglobin. The reason why the emphasis on 8-wavelength pulse oximeter is that the common one is the pulse oximeter that we use 2 wavelengths, okay? And that will determine the proportion of hemoglobin saturation with oxygen using spectrometry with light at 2 separate wavelengths. And that will illuminate the oxygenated and deoxygenated hemoglobin in the blood. Okay, with that, we can get oxygen saturation. The 8-wavelength pulse oximeter will help us more. You can get that as a RAD 57, that's Massimo RAD 57 from Massimo Incorporation having CA. It's a pulse oximeter with sensors that is capable to reveal carboxyhemoglobin that is not above 15%. So it can pick 0 to 15% of carboxyhemoglobin and can pick methemoglobin between 0 to 12%. Still on diagnosis, we have to compare the values from 8-wavelength pulse oximeter with the laboratory values. In the past, plasma carboxyhemoglobin level was the gold standard. In fact, many people will use only that. But we will use the values from 8-wavelength pulse oximeter with arterial blood gases or venous blood gases. The reason why I went straight to arterial blood gases is that you use that both in unstable and stable patients. While in stable patients, you can use the value of VBG. We have to determine the level of carboxyhemoglobin and methemoglobin, okay? But let's quickly look at this before making our determination. The carboxyhemoglobin normal level in non-smokers is 3% or anything less than 3%. But once it is greater than 3% in non-smokers, that is carbon monoxide poisoning. Then the question is, what about smokers? Smokers, they have the luxury of having a higher value of carbon monoxide that will still be regarded as normal because they are smoking. So that is between 10 to 15%. Once the value peaked is greater than 15%, that is carbon monoxide poisoning. And of course, we call the toxicological people for toxicology screening. The value of carbon hemoglobin is just to know that an individual has been exposed or not. That is not the determinant of how severe or how toxic the situation is. So the value does not determine severity or toxicity. It may be negative under certain situations. Number one, when there's a long time after the exposure to carbon monoxide, or first thing first in most health centers is take O2 once it is this level, give 100% oxygen. If that has been done, we might get negative value. The reason why long exposure, time between the inhalation of carbon monoxide could lead to negative value when it is tested is because once you're out of the dangerous area, you're out of where you are, inhaling the carbon monoxide, and you are exposed to oxygen, and you're exposed to oxygen for a long time, then the value of carbon monoxide will be dropping. The treatment and progress or prognosis will then be based on signs and symptoms, not necessarily the value that is picked. We can use venous blood gases to monitor carbon hemoglobin level when the patient is already on the treatment. If it is fire incidents and you are contemplating on giving hydroxycobalamin to reverse the cyanide effect, then quickly have the sample taken before you administer the hydroxycobalamin. Okay? Hemoglobin-bound oxygen will be drastically reduced in the face of carboxyhemoglobin presence. Still on diagnosis, you should have immediate EKG and cardiac enzymes acid. With that, we want to know how badly the heart has been affected. Remember I said earlier that the entire system will be affected, but the brain and the heart will pay more. Depending on the signs and symptoms, you may go ahead to rule out the level of damage to the central nervous system. So you may or not do the following, like CT scan, MRI, or PET. When you do this, if there is damage to central nervous system, you may pick globus pallidus hemorrhagic infarction or deep white matter hemorrhagic infarction. You can have renal function test done. Why that? I will let you know in a bit. Creatinine kinase, urinalysis for protein because you want to rule out rhabdomyolysis, okay? And then you can have liver function test done to rule out hepatic failure. There may be mild leukocytosis, so have complete blood count done. And of course, estimate the glucose level. Arterial blood gases will be helpful to determine metabolic acidosis from lactic acidosis. Troponin, like I said earlier, CKMB, like I've said earlier. No, I didn't mention CKMB, sorry about that. Troponin, CKMB, no, you know what you're targeting, right? You want to rule out myocardial infarction. In pediatric age group, something different will happen. The children and adults are exposed at the same time to carbon monoxide, right? It's only the older children that will be able to tell exactly how they are feeling, correct? How about the younger children that will not be able to verbalize it? But the younger children will start signs and symptoms earlier than adults, although exposed to it at the same time in the same environment. So our index of suspicion will still be high up there. So the children will come out with fussiness, feeding difficulty, but they will have less of delayed neurological sequelae when you compare that to adults. Okay, which way out? That's a big question. And of course, this time it's not a small answer. There will be big answer to this big question. And that is, how do we treat carbon monoxide poisoning? Let's go. First thing, call poison center. Remember, we've reached this point because you've made your diagnosis already. Because if you have not made the diagnosis, then what are you going to treat? The main goal here is to give more oxygen to help in displacing carbon monoxide from the hemoglobin. Okay, high flow oxygen will help through a non-rebreather mask, that is normal baric oxygen. Then we'll review the clinical state with toxicological results. So generally, we'll check the airways for foreign body, secretion, patency, and endo as is appropriate. Then the breathing, central peripheral cyanosis, tracheal deviation, accessory muscles of respiration in use or not, any obvious deformity in the chest region, abdomen moving with respiration, an obvious respiratory distress or not, what is the respiratory rate, air entry decrease or not, percussion in the chest region donors or not, and what have we picked on auscultation, specifically the breath sound. And then the circulatory system, fluid in and out, what is the pulse rate, what is the blood pressure, then skin toggle for dehydration or not. And we must rule out pregnancy here. Beta-macronine gonadotropin for any woman of childbearing age, if they can't remember the history. If inhalation, we have to measure cyanide level. Remember, cyanide and carbon monoxide can coexist and they have synergistic effect. Hydroxycobalamin, some call it hydroxycobalamin, some call it hydroxycobalamin, depending on North America or Europe, whatever. For cyanide, as hydroxycobalamin intravenously, to be infused with D5 water. That is, once we are suspecting or we are sure that there is cyanide, we have to administer this to help quickly. We should intubate, should determine whether that will be necessary or not. Once that determination is made, we go ahead. 100% oxygen, that is normal baric oxygen, depending on the values, the severity, and so many other factors. We'll check when we need hyperbaric in the bed. High flow oxygen to all patients, regardless of what the pulse oximetry is telling us. Then hyperbaric oxygen, the next slide will lead us to the conditions when we can give hyperbaric oxygen. But if you want to know more about hyperbaric oxygen alone, you can click on this link. I have published a separate presentation on hyperbaric oxygen. Now, the hyperbaric oxygen in the face of carbon monoxide poisoning. There's no need of hyperbaric oxygen if the value or level of carbon monoxide poisoning is mild or moderate. But hyperbaric oxygen will become necessary when we are faced with the following. Number one, the carbon monoxide or carboxyhemoglobin is greater than 25%. Some authorities will put it as anything greater than 30%. Some will put it as 25 to 30. But why not saving a life quickly at anything greater than 25%? Then go for hyperbaric oxygen. If carbon monoxide is greater than 20 in a pregnant woman, that is why, or one of the reasons why we would need to have pregnancy ruled out quickly in any woman of childbearing age, because we'll make the determination for hyperbaric oxygen earlier than the rest, people that may be involved. So in a family where everyone is involved and a pregnant woman is there, if the value in the pregnant woman is 20%, we'll go for hyperbaric oxygen, but that is not enough to go for hyperbaric oxygen in the rest. If there is no loss of consciousness, we'll go for hyperbaric oxygen. In severe acidosis with pH less than 7.1, we'll go for hyperbaric oxygen. Still on whether to go for hyperbaric oxygen or not, we will go for hyperbaric oxygen if the carbon monoxide poisoning is associated with chest pain. Okay, there is altered mental status, neuropsychiatric development, or this is an older patient, 75, 85, 95, go for hyperbaric oxygen. Or there's obvious heart-related issues, when the EKG has been run on the patient, then we seek hyperbaric oxygen immediately. We'll go back to all the diagnostic parameters and check the values. Remember, we would have sent arterial blood gas to the lab, and then we want to know the value. We want to see what's happening to the renal system, to the hepatic system or liver. We want to know what the value of complete blood count is. We'll call the toxicological laboratory back. What have they picked through the toxicological screening. So we'll review all those parameters again while we're dealing with the patient, because we want to know what to add, what to stop right now. But we'll still continue oxygen administration until carboxy hemoglobin is less than 10% and the patient is asymptomatic. Regardless of what we're picking here, while reviewing the laboratory results, once the carboxy hemoglobin level is not less than 10% and the patient is still symptomatic, oxygen must not be stopped. We will only stop administration of oxygen flow only when the carboxy hemoglobin is less than 10% and the patient has become asymptomatic. And then we can discharge home only if the patient is no longer symptomatic, carboxy hemoglobin is less than 10%, but if the person is a smoker, well, the carboxy hemoglobin may be greater than 10%, but not up to 15%. Because smokers can cope with carboxy hemoglobin between 10 to 13%. So we can let them go at this value. Now, the next thing now is a piece of advice. We have to be proactive. Being proactive. We won't wait till the evil has occurred. We will act ahead of time. So what can we do? We don't want carbon monoxide to kill us, to kill our loved ones, to kill our neighbors, to kill tenants living around us or ourselves. So what can we do to prevent that? Now, prevention, they say, is cheaper than cure. That is, if the situation is curable at all. Remember what we've gone through. If someone has come down with carbon monoxide poisoning, the fact that you've been treated today with high level of oxygen and you are out might not be the end of the story. You may have DNS, delayed neurological sequelae, that can teach you to anything, including psychiatric disorder that you've never been diagnosed with. So, you have to be careful. If the patient is suicidal, meaning from the history, we could pick that this has been done intentionally, then we will advise that the individual should seek help. We will even help the individual right now by inviting appropriate experts to handle that. Call 911. If you notice someone trying to intentionally poison him or herself or poisoning someone else with carbon monoxide, please call 911. Seek help immediately. Still on preventive measures, Once there is burning in any place, the first thing you should do is get out as quickly as possible. Just get out, okay? Abandon your vehicle. Run for safety. Open the doors and windows. Call 911 or fire department depending on what is available in your country or jurisdiction. Don't stay there. It's not the time to meditate on anything. It's the time to move and get out. Okay, service your fireplace depending on the regulation in your jurisdiction. But for your own safety, because it is colorless, it is odorless, it is tasteless, it's non-irritating. You may not know when you and your loved ones would have inhaled it. So service your fireplace regularly. Some jurisdiction will say every year. Well, I don't know, whatever is available in your jurisdiction, but for your own safety, get that done, please. Please, it's pretty cheap. Get smoke alarms everywhere in the building. Please get it, and then fire extinguisher could be readily available, and make sure you have learned how to operate it. Okay, always open the garage doors when vehicle is running. The first thing is, before starting the engine of the vehicle, let the garage door be open. Gas appliances to be properly adjusted. Still on prevention, gas stove outdoors with exhaust fan placed. Home carbon monoxide monitors should be in place with alarms. Not that expensive, and it will save lives. Vented space heaters should be what we're going to install if we need one, because that is better than the unvented heaters. The door on wood stove should be tightly fitted, please. Open flues when fireplace is in use. Home inspection before buying the house will help you. Please do that. The prognosis. Although it depends on the level of inhalation, but when there is severe or carboxymoglobinemia, there is likelihood of high morbidity and even high mortality. And delayed neurological sequelae is another problem even after being treated and discharged. The situation will be worse with cyanide. Remember, synergistic effect, although all negative. The possibility of brain and the heart being damaged is pretty high. In conclusion, carbon monoxide is a dangerous gas. Let's go for the history of smoke inhalation, but that may not be so clear. So, high index of suspicion will be what will be required to make accurate diagnosis, then embark on arterial blood gases, and then 8-wavelength pulse oximeter values. We have to review the preventive measures to stay out of being poisoned by carbon monoxide. In all, just be careful. Be careful. It is a dangerous gas. It can kill. If you notice that someone is trying to do that, assist, call appropriate authorities to help out. With that, I'm saying a big thank you for spending 48 minutes to listen to this presentation. Kindly share this with everyone. Let the whole world know that you can get carbon monoxide through this means and you can die from it. Seek help. It could be treated. Take care. I appreciate it.